And now counties have been warned to brace for challenging times and a heavier burden as cases of COVID-19 in the grassroots continue to surge. Devolution Cabinet Secretary Eugene Wamalwa says the current pandemic will determine if the move to devolve health services was timely. The development coming as county governments continue to engage technical and vocational education training institutions in production of personal protective equipment in the wake of the coronavirus pandemic.
Technical training institutions have proved critical pillars in the fight against COVID-19 disease, coming up with innovations necessary to cushion health workers and the public from the disease. Education Chief Administrative Secretary Zach Kenodia urging county administrations to continue supporting such institutions, restating that they are key to transforming society.
We have technical training institutes, which are government-run, others are run by county, which are making PPEs for exports. You know, you say Rivertex, you could say Kikotech, you could say NYS. All those are TVET institutions, and they have contributed greatly in combating the disease by providing real-time materials that are fighting this.
The call coming as counties were warned to brace for challenging times and heavier burden as cases of COVID-19 in the grassroots continue to surge. Devolution Cabinet Secretary Eugene Wamalwa says the current pandemic will determine if the move to devolve health services was timely.
Utilize that money prudently to build their capacity to improve health services. We're also, through the Ministry of Health, able to release another 3 billion, almost 2.8 billion of which is going directly to the counties. And this should also help the counties.
Meanwhile, a section of COVID-19 patients currently under care at the Migori County COVID-19 Treatment Center in Makalda have decried what they say is mistreatment and poor management of the virus by health officers at the facility. Some of the patients say individuals who have been in care at the treatment center for over 10 days are still confined in the same room with people joining the treatment center for the first time, increasing the chances of cross-infection. Migori County Executive in charge of Health, Dr. Iska Oluoch, is however dismissing the claims, insisting that such claims are abstract and wild.
We have a number of selection criteria. Technically, Nyatike or Makalda Sub-County Hospital is the best. Number one, it is vast. It has a wide space, so then it is free for. I mean, it can the possible infection, whatever transmission is reduced. It is vast.
And the Embu Water and Sanitation Company says it has put in place elaborate measures to ensure continued supply of water to area residents during the COVID-19 period.
We decided to have the use of the smart cards when it comes to fueling of our motorcycles and also our motor vehicles. And this is going to help us so much in terms of saving costs.
Beatrice Gatonyingetich, Channel 1 News.